ALTA-positive lung cancer represents between 4 and 7% of non-small cell lung cancer. Classically, these are people with little or no smoking history. They're often younger than the average patient. The average age range may be in the 50s. The ALTA-1L trial was a first-line trial comparing a next-generation ALK inhibitor, brigatinib, with the older ALK inhibitor, crizotinib. Patients were allowed in if they were proven to be ALK positive based on a local test. Prior chemotherapy was allowed, but no prior ALK inhibitor, and they were randomized to the brigatinib or the crizotinib. And the primary endpoint was a blinded independent radiology review committee's assessment of progression-free survival. The first interim analysis, which was done at 50% of progression events, was then followed up with a data cut of June 2019 with the second interim analysis. This was done at approximately 75% of progression events. The progression-free survival by the independent radiology review committee had a hazard ratio of 0.49, exactly the same as was seen before, but now we have a median about 25 months. About 30% of the patients in the ALTA-1L study had brain metastases at baseline. This was balanced between the two arms, and about 30% of those had prior radiotherapy, most of which had been whole brain radiotherapy, a few of which had had stereotactic radiosurgery. What we can see is in the group that had baseline brain metastases, the hazard ratio was even better than in the overall population. And we'd previously seen that that was the group that had the biggest and earliest differentiation between the two arms. And we saw a hazard ratio there of 0.25. What we saw in ALTA-1L was not only was the degree of improvement in health-related quality of life better, but it lasted longer. The time to deterioration symptoms was also better with the brigatinib. One of the things that we need to understand is the full duration of benefit of these next generation inhibitor drugs. In terms of the unmet clinical needs for the ALK positive population, although there are multiple different ALK inhibitors and multiple other treatments that we can employ, these are patients that we want to give perfect control of their disease with zero side effects. That is the goal. None of these treatments are cures, so we need treatments which will provide better and longer control of their disease.